message now, everyone.
Got it.
But I didn't want to interrupt you while you were talking with that little
Oh, no, not a
announcement.
problem.
So,
Not a problem.
yeah. So does anyone have a question? Now's your time. Oh, I
Can
see
you
it.
hear me?
Yeah, I can.
can.
Dr. Campbell,
Okay.
yep.
This is Dr. Orville Campbell with Improve Health. I work out of Nashville, Tennessee, but I work for Michigan Peer Review Organization, or Improve Health. Thank you for your presentation. How do you go about changing the views in the minority community on organ donation? As a physician that practiced for 25 years, when I've had to have the conversation about organ donation of someone that's clearly not going to make it, there's a distrust that, and the number one reason would always be, are you all doing enough for the person, or you're just going to let them die so you can have their organs? How do you change that mistrust, and what strategies have you used?
Yeah, it's a really great question. The first thing I would say, and I'm sorry, I missed your name.
Dr. Orville Campbell.
Dr. Campbell. Good. Thank you for that question. So one of the things I would say that's as a strategy is to just invite those conversations. So we know that a lot of the mistrust is there. We know that there's a lot of myths around organ tissue and eye donation. One being that they're not going to, as you just noted, they're not going to save my life or the life of a loved one. They're not going to, as they would someone else. And so what we have found to be helpful is really inviting those conversations, because we want to understand the barriers around which people, why they do not, they don't believe in donation, they don't want to become a donor. And then I would say from there is asking the question, well, who in your family or in your community do you know who is on dialysis, or who's had a knee replacement, or things of that nature? We start to ask people a little bit, because I think what we have found is that people may not be connecting the dots to understand that if those types of things, musculoskeletal tissue surgeries have been needed, there's been a donor behind that. And so that's another piece that kind of helps to bring people, I think, into the conversation. The other thing that we have found to be really helpful is when going into communities, and I mentioned going into community to ask how we might support them. Community engagement is all about is long-term. It's all a long game. And so I may not go into a community right away and talk about donation, but I might talk about what are the health care needs within your community, and then talk about at some point when there's a level of readiness about how donation is a part of the cycle of health and well-being within your community. So maybe let's talk about how we might think about the option of donation as a part of that cycle. Those are a few strategies we have found to be useful.
Thank you very much.
Thank you for the question. Any other questions? All right, Claire, am I okay to move on?
Yep, you're okay.
All right, really great question. Thank you again for that. So for us in LifeSource, within our donor service area, we have had an immense opportunity and privilege to partner with a number of community organizations that are trusted members of the communities and have been great partners in helping us to, again, elevate conversations about organ tissue and eye donation. Many of the partnerships that you see listed here are primarily in our metro area of the Twin Cities, but we do partner with several organizations throughout our donor service area. And so, again, as I mentioned, community engagement, building partnerships sometimes takes a while. And that might start by doing education in a community. If you do like a hosting a table event or something like that. But thinking about the long game, again, consistently showing up is really key to doing this work well. And as I mentioned, thinking about the cultural brokers who might be in communities. So those might be members of communities who already have a lot of trust. So community leaders who have the trust. It's also really important to connect with those individuals or individual in order to bridge the relationships with communities. Okay. So in 2016, I hope I'm getting this right. We received a grant to fund doing some work with communities. And the result of those grants were what we call and still call our Barbershop Conversations and Talk Donation campaign. The Barbershop Conversations was a way to elevate, again, have conversations about organ tissue and eye donation, specifically in Black and African American communities, and more so with trusted messengers with barbers and their clientele. And so we have, over the years, and I just want to drop a name here, Dr. Clarence Jones, who's been a longtime partner of LifeSource, was really helpful in getting this program up and off the ground. And so we are still connected with local barbers in our areas who, again, are really key community members to have conversations about organ tissue and eye donation. What we have found with our barbers is that, and for those of you who know who may go to barbershops or salons, is barbers can often serve as your counselor, your mama, your daddy, your grandparent, your teacher. And so there was really a great opportunity to leverage their role in communities, again, as trusted members of communities, to talk about donation, again, as a part of the larger, broader conversation about health and well-being in communities of color. And so this is a program that we have been really excited about expanding this year and in the years to come, as well as the talk donation. So the talk donation was also a campaign that focused on communities of color, specifically Black, African American, and our indigenous tribal communities, to talk about organ tissue and eye donation as well. What you see on the right there is an advertisement that of some artists that was done by a local artist around thinking about donation as a conversation. So I mentioned earlier, just inviting the conversation with communities is really oftentimes what helps to kind of move the needle on changing the minds and hearts of people who may not have seen donation as a viable option. Here are members of the Talk Donation campaign from our tribal communities. And again, what was significant about this was just acknowledging that for some tribal communities, not all tribal communities are the same. However, there's sometimes this idea that in tribal communities, that the body needs to be whole when transitioning. So in talking with a couple of folks from our tribal communities who participated in some focus groups, we found that many people were impacted by donation and had no idea. And so having these conversations is really important in order to not only educate communities, but get communities to understand that donation, again, really impacts a lot of people. And so what we've got here are, again, a couple members from our tribal communities that participated in this campaign. To the very left there is Patina Park, who serves as Executive Director of Tribal Relations out of the governor's office here in Minnesota. And then Dr. Thomas Wyatt, who's next to her, Second from the left is an emergency room doctor at Hennepin County Medical Center here in Minneapolis, and also serves on Life Sources Community Advisory Council. And so I mention that because the other thing that we have found to be very key and important is having members of communities who are very well connected to their communities to help us inform us of our work and how we work with communities. And so what I want to do is I want to just highlight a couple of events that were pretty significant last year in 2020 that were the result of kind of these ongoing partnerships that we've developed and continue to deepen over time. And so Live Your Healthy Life was a first-time event that was sponsored by one of our local barbers, Tito Wilson, who has a shop in North Minneapolis. And this, LifeSource helped to sponsor this event and also hosted a table at this event. And what was significant about this event was that it was, again, a focus on health and wellness, and was kind of a block party approach to really elevating conversations about health in the Black community specifically. And if you know anything again about North Minneapolis, the intention of having this event on West Broadway in Minneapolis, which is very active, I'll just say that, can often be very active, was just a really great way to bring together community leaders, have fun, and really focus on the health of the Black community in a fun and inviting way. And so there you see a number of people that sponsored, a number of companies and organizations that sponsored this event. And this is something that we're looking forward to doing again this year. Let's see. All right, so one of the organizations we have partnered with over the last several years is the Human organization that again focuses on healthcare in communities of color, several diverse communities of color, specifically looking at the health crisis in many communities. And so we had the honor of hosting an event called Small Decisions Matter that was hosted by Human to focus on heart health and diabetes prevention, specifically in communities of color. And what was beautiful about this event, as you see there on the right, is we had a local artist that put together portraits of many of the individuals who were honored at this event, who had been impacted by donation in some way. And so the gentleman there that's on the right, who's in the blue, Kevin Jenkins, is a LifeSource ambassador. So oftentimes you will see him at LifeSource related events to talk about his story of being a kidney recipient. And so really just a really great way to just, again, elevate the conversation about organ tissue and eye donation in communities, to partner with organizations who are, again, focused on health and wellness in marginalized, underrepresented communities, and the importance of also just connecting with community members who can support the work that you're doing. All right, just going to do a time check here. So this is a really great story, and I like to talk about this this story because this is, in my mind, a perfect example of what it means to do true, authentic community engagement and to look at the importance of developing partnerships over time. So last year, a group of us traveled to Belcourt, North Dakota, to meet with the Turtle Mountain Band of Chippewa Tribal Council to talk to them about our work a little bit. And the reason we were able to do this was because of a relationship that we have developed with Joan Azure, who is a member of the Turtle Mountain Band of Chippewa, is also a LifeSource ambassador, and is also a member of our Community Advisory Council. Joan's grandson, Grayson, passed away in, I get this right, September of 2019, after having received a heart transplant. Joan's advocacy was palpable. So as a result of her and her family's experience going through Grayson's healthcare journey, and his subsequent passing, Joan became a passionate advocate for donation. And because of that, we were invited to go to the tribal council. And at that meeting, the tribal council adopted what was called the Grayson's Initiative that added donor registration to tribal IDs. And so that was adopted on June 7th of 2022. Here is Grayson, beautiful child, well known for his beautiful smile. And so as a result of that adoption, in November of last year, we traveled again to Belcourt, North Dakota, to celebrate the Tribal ID launch event. What is significant about this is that this is the first tribe in the country to have done this. Some of you may have heard the story. We had the AP came out with a story about this, just highlighting again, the advocacy of Joan, who's listed there in the center, and then her family is to the left of her. The power that happens when community comes together, and when you have one individual who is so deeply committed with the support of people who really want to see this happen, come together. And so we traveled and were able to participate in this tribal ID launch, where many members of the community were invited to hear about the story of Grayson. Many of them knew about Grayson's story, but came together in an amazing way and had the opportunity to actually register as donors on their tribal IDs. And so here is a picture of Joan in the background, and where you would see donor listed on a tribal ID. This story is so impactful because, again, it hits on so many levels. So I think just the importance of really building community relationships over time, thinking about how to support members of communities where, again, organ tissue and eye donation is not something that's normalized, or in some cases just not even really thought about or talked about. This is an example of how things can come together, and how, again, the power of one person can really change the minds and hearts of a community. And so we like to talk about this a lot, because this is, in my mind, an example of true, authentic community engagement. A couple of examples here before I close are of some new engagements that we are embarking on, is with what's called the Hawthorne Huddle. So the Hawthorne Huddle is a group of people in North Minneapolis who are looking at health and wellness, I would say more broadly, in the North community where we're headquartered. Also, I mentioned that we are in conversations with the governor's office to hopefully connect with more communities about elevating conversation and offering education around organ tissue and eye donation. So specifically broadening our work with our tribal communities in our donor service area, and then also with other communities, underrepresented communities in our donor service area as well. On our website, we have several resources that we oftentimes like to direct people to visit. There's tons of resources around about donation. Again, I mentioned earlier the importance of really elevating and inviting conversations about donation that may or may not be accurate. I think, again, that's that's important to help build trust in communities. One thing to keep in mind is that it's important to have this information in different languages. And then also keeping in mind that some communities may have limited or no access to technology. So the importance of getting out into communities and having representatives from communities to talk about donation can be very impactful in this case. Then we have several materials and resources that talk about donation when we're out in the community. Here you see these are little kind of, what do you call it? Little business cards that we can share and give out to community members that talk about some facts about donation. And if you see here, one of the last check mark there on this card on the back is that your life comes first. The hospital's priority will always be you. So this is really acknowledging the fact that some people do not believe that if someone that hospital staff, doctors, nurses will really work hard to save the life of an individual. So again, just acknowledging the myths and the fears that people have is really important. And then those that are listed, you can see a little bit there. Tito Wilson is the barber that I mentioned. You can see his face there, just a tad right behind this first card. And then other members of communities that are also represented on our materials has also been really important, so that we have materials that represent members of communities who are supportive of donation. All right. And I think that is going to just about do it for me. That went by so fast. So I want to just thank you all again for your time, and Claire for the invitation. I would love to speak with you more if you have questions even after today. So my information is listed here. And I think what I will do is I'll stop sharing and then see if we have time for a question and answer. Thanks so much.
Sounds great. Thank you, Nicole. And I don't have anything in the Q&A right now, but again, feel free to take yourself off mute and ask any questions or provide any comments if you'd like. I just want to say that for me, what really stuck out, Nicole, is when you provided the slide with all the different organizations, primarily in the Minneapolis area, of other stakeholders in healthcare with different communities. And I have lived in Minnesota my whole life and had no idea, that any of those organizations exist. And it really, for me, highlighted the gap of, where we're missing partnering with those key other community organizations and stakeholders to just increase the health of our communities. So that was really a highlight for me. And again, about consistently showing up, because it's a long game. So yeah, that was really key for me. So thank you.
Yeah, my pleasure. Looks like we have a question from Dee.
Oh, Nicole, thank you for joining us today and presenting. As Claire mentioned, just such an honor and such a serendipitous to meet you and enhance the work that we're doing here in the kidney community. LifeSources had such a great success identifying key advocates in the communities that you serve. I think I think you'd agree that's been such a key to your success and all the projects you're doing. And one of our hopes in presenting and inviting you is, how do we take what you've had so much success with and bring it into our own communities? So I'm wondering if you could maybe talk just a little bit about how does LifeSource identify these wonderful advocates? And then how can we go about doing that in our communities? And then how do you keep them engaged? Just some tips and tricks. So how do you sustain that engagement and then identify the great advocates that you've been so honored to work with?
Yeah, so I think, again, I'll just emphasize just the importance of showing up. So and kind of looking beyond, opportunities that might align with the work you're doing. So again, using Martin Luther King Jr. Day as an example, Martin Luther King Jr. Day is oftentimes looked at as a day of service. And so if there are people that are out and about in the community, participating in a day of service, you might have an opportunity to connect with someone who is, again, a leader in the community, and just invite them to have a conversation about what they're doing, and then invite them to talk about what you do as in your work. And so showing up, being on the ground, I think is really key to working in community. The other thing I will say, I think what was really key about us having a community advisory council was that we had, again, we have members of diverse communities who are connected in communities in several ways. And so oftentimes your community advocates are so well networked that they know they know several people in several different communities, and they just kind of know how to navigate. And so connecting with those individuals is really key. I know for me that I've been doing community work probably for as long as I've been able to work. And so I've developed a pretty solid network of people. And if I don't know somebody, I know somebody who knows somebody. And so that, I think, is again, when I say showing up, it's just showing up in places that you may not think you should show up, just for the sake of showing up, and just letting people know that you're present.
Thank you.
Mm-hmm.
And Dr. Campbell, I see you have a question.
Yes, so it's good to hear D or CD. Just want to say hello, but anyway, what role do churches play in your engagement in the large dialysis organization, if they do play any engagement role?
They play a huge role, because again, churches are places where many members of communities or faith organizations, people trust them, communities trust them. And so there is, I know, opportunities where we have invited people from different faith backgrounds to come in and talk about their faith and their community, and to educate us about, how might we talk with members of their communities, knowing, again, that in some communities, donation is not acceptable, or it's not something that people necessarily know much about. I know for some LPOs, they're deeply connected with their churches, because the churches also provide, for example, if churches are doing food, providing food drives or food pantries, that's where we could get involved and we could get connected, because it's with the community. Again, we may not say to them directly that this is what we do, but if we're consistently showing up once a month to volunteer to help manage the food pantry, or whatever event is being hosted by the church, that's a way to, again, to develop relationships and for community members to know that we're in the community. But again, churches are super key in this.
Thank you.
Mm-hmm.
Are there any other questions for Nicole or comments? I know for one, it gets me thinking about, I used to work in in-center dialysis, and thinking about, how in the dialysis centers, when we're, that one-on-one with the patient, the boots on the ground frontline worker, thinking about, what kind of resources can we have in our toolkit to help get information to patients from someone, again, like you said, that has that partnership with within the community, a trusted resource for that patient. And I think there's a lot of room for work and an improvement in how we provide education and resources and referrals to patients around organ donation.
Mm-hmm.
Yeah.
Yes. Yep. Yep. And I would say too, just acknowledging and knowing, I know for many of our team members who work in our hospitals is recognizing that for many community members and families from underrepresented backgrounds, there is a history. There is mistrust, and that mistrust, again, I would say needs to be acknowledged, and just understanding that might inform how I approach families and how I communicate with families. The other thing I would say is the importance of really understanding what it means to be culturally conscious, culturally responsive, culturally sensitive to different communities is also really important.
Absolutely. Any other questions or comments from the group? Takeaways? Everyone's shy today.
A quiet group.
I know, right? Well, I appreciate everyone joining, and if you do have comments or questions that didn't want to ask to the group, you certainly can email myself or Nicole. Her information will be available on the slide deck that we'll share. And I just want to thank you so sincerely, Nicole, for joining us today and providing this incredible presentation. We really, really appreciate your time and expertise.
Thanks, Claire. Again, my pleasure, and have a great rest of your day, everyone.
Thank you. Thank you, everyone.